Hello everybody, my name's Adrian Thorne. I'm the lead governor for Southern Health, as well as being a appointed governor for Carers Together. Firstly, I'd like to welcome you all to our annual members meeting this evening. Now, we all know that it's been a challenging year. We've had the pandemic, which has led to additional demand. We've got staffing problems in terms of recruitment and retention, and which mean that people are having to spend a lot of time doing different things over and above the day job. So I'd like to start by thanking a number of people. I'd firstly like to thank our board. I'd like to thank our chair, our NEDs, our executives for all the work that they've done in the last year in what's been quite difficult situations at times. I'd certainly like to thank all of our staff. Our staff are our greatest asset without any doubt, and are always doing the best they can for our patients and carers. Also, I'd like to thank the partners that we work with, be that local authorities, be that other health trusts, be that the third sector, and also our patients and carers as well. The AMM theme, or the annual members meeting theme, is better together, and it's really about working in partnership. I'd like to look at that from a governor's perspective. For us, I suppose there are 5 main areas that I can think of. We need to represent our members and our population. We need to represent our staff working within the trust. We need to help and work with the councils that we have relationships with. We need to work with the third sector. As well as that, we also need to work with our universities. We have now got university status. So going through those areas, firstly, representing our members and our population, I think the pandemic has meant that it's been very, very difficult for our governors to be able to talk as much as they would like to our members and our population and our patients and our carers. The Trust has done everything it can to help and to support us do that, but nevertheless, we need to show an example as a trust and follow the rules and regulations very, very clearly and tightly, which has meant that face-to-face meetings have become really, really difficult. I'd like us to be able to do what we can to talk to our members more frequently in a more joined up way, to make it more about co-production rather than communication. We need to be getting stuff back from our members and our patients so that they can influence the way in which we provide our services. I think the other thing for me is we need to be honest about what it is we can do, but we need to be really clear about what the expectations of services are with the resources that we've got. Now, I'd like to move on now to representing our staff. We have a great team of staff governors. I think reflecting back to the trust what the staff are feeling is a really, really key area for us. And we need to listen to our staff in the same way as we listen to our members. Thirdly, the local authorities. We need a close working relationship with our local authorities. We need to think about how we interact with social care. We need to think about things like housing and transport, and also in relation to some of the councils, they've got infrastructure that potentially we could make better use of with them. And I think that's a really important area that we need to follow up. The third sector is an area obviously I know something about, and I think we need to work with them in a broader way, in a more partnership way. They've got skills that we don't have, and they've also got a way into listening to local communities. We need to work much closer with them and listen to them and get them to do the things that they're good at to be able to support and help the trust as well as our patients and carers. Lastly, we have now university status, which is a great thing for the trust, but also we need to think about how we can influence qualifications so that they become more relevant to the jobs that we've got available within the NHS. Another area I'd like to have a quick word about is the ICB, or the Integrated Care Board. I think this is a great opportunity for our services within Hampshire to come together in a really meaningful way. I think it gives us great opportunities to actually work together so that actually we're putting the patient at the centre of all we do, and having constituent parts of people from the Foundation Trust and also from local authorities actually on the board should lead to better discussion and better decision making across the economy. So finally, I'd just like to thank you for coming along tonight. Hope you enjoy the evening, and my very best wishes to all of you and all your families.